He has served 2 terms as president of the Brazilian Society of Aesthetic Dentistry, and he is currently the vice president of IFED. It is with great pleasure I present to you Dr. Jose Roberto Moura.
Well, thank you very much for the introduction. It's a great honor for me to be here. I'd like to first congratulate the whole staff of the whole board of the American Academy of Aesthetic Dentistry and also the International Federation of Aesthetic Dentistry for the great job you've been doing so far. I'm really thrilled to be here, a little bit scared, believe me, and we'll be talking about quality control in restorative aesthetic dentistry. Actually, it's microscope quality control in restorative dentistry. I know many dentists don't like the idea of using a microscope in an everyday practice, but please don't leave the room yet. Bear with me here a little bit, because I'd like to show you that it is possible to do a restorative practice using a high magnification in an everyday basis. Aesthetic dentistry has done so much to our patients. I'd like to show you one case that we did many years ago. There was a young girl who came to us, and we had her compromising teeth restored with direct composites. We had nice results at the time. We were pleased, the patient was pleased. She disappeared for quite a amount of time. Then she showed up after a while, and we could see that most of the restorations were still in good shape, even though we had some minor inflammations in some points, in some papilla, and probably because of something we did wrong at that time. We must have missed something there. However, failures in aesthetic dentistry can be a lot more catastrophic than that. Just to have 3 examples. We see here a situation where inappropriate etching and bonding was done. Another situation where a patient complained that her tooth was internal bleached for over 3 times, and she thought that this type of technique doesn't work. Actually, if we take a closer look at that, we can see that the pulp chamber wasn't even cleaned enough before doing the procedure. And in another example, we have here these veneers. Of course, it doesn't have a nice aspect, but the complaint of the patient wasn't the aspect of the veneers, was that her gingiva was bleeding a lot. And we can see that there is excess cement that wasn't removed. We can see gaps, and we can see lack of adaptation of those restorations. So we are dealing with those situations every day in our practice. And how can we avoid those failures? Ronnie Goldstein says that we need professional capacitation, adequate use of good quality materials, and precise techniques. If you see that video over there, you can see that we have to take a very good care when we're removing old composite, trying to preserve at the most the sound tooth structure of the patient. We have to be very careful when we are placing our composite in order to achieve the proper anatomy of what we are looking for. We must be careful also when adapting one layer of composite over the other one, not to trap dirt or air bubbles between them. And even in finishing and polishing, there are so many details we have to watch for so that we can have a natural look. A class 4 restoration like that is a viable option today. It is cost effective. We can do that with the proper training in about an hour, depending on how fast you are. We can do that in an hour and a half. And still, I think it's a good option to the patient. However, that's the final result we had in that case. And moving on, there are a lot of other things we should look at when we're trying to avoid failure in restorative aesthetic dentistry. Sometimes we ask ourselves, is that caries? Is that not a caries? I don't think you need some some laser device or anything to find out. Just have to look at it. And if we need some adequate training, we need some little lab training. It's in restorative dentistry, the training is it isn't too difficult. It's different like when you're learning to do a periodontal microsurgery, which is a technique that was developed to use especially with that type of instrument. In restorative dentistry, you're just going to do what you usually do. You don't need much, but you do need some training. Otherwise, you will be working like this, probably. Okay, you won't know what do you do with all your instruments. Okay, you might not know what to do with your headlights, with your loops, with your microscope, everything at the same time. You might get lost in it sometime. You might try to look at the microscope a little bit, then it gets tiring a little, and then after that, you don't see it right because you didn't focus. Then you have to peek outside of that. Then you get tired of that. You put the microscope away, you put your headlight again, you put your loops on, and then you keep changing. That's tiring. That is something awful. If you do like that, the only thing you're going to have with a microscope is the most expensive hanger you ever bought in your life. Okay? I was goofing around, just trying to show what I did in the beginning. I really did that in the beginning. But then sometimes you forget stuff. You get all this stuff. And then you put your loops with the microscope at the second time. Okay. Some foods for thought here. Nowadays, compromising results are no longer acceptable. And I would ask you, will traditional methods be sufficient to face the working market that is ahead of us? I don't mean here in the United States. This is an international conference. I mean in other countries. I don't know. Even with the growing demand for positive results, and that is worldwide. That is worldwide. If we make a choice for precision in medicine, why not in the mouth? Why am I saying that? Because you might think I'm being too dramatic here, but if you're looking for, I hope nobody ever needs that, but if you need a brain surgery, are you going to look for a surgeon that uses a microscope or one who doesn't use a microscope? Or if you need a hand surgery? But then you're going to say, oh, but isn't that too much? I don't know. Is the mouth so less important than those organs that we shouldn't do that type of precision to that? I don't know, that's something to think about. Bottom line, the operative microscope is just a tool. It is a tool. Nevertheless, the best one regarding magnification and illumination. I would like to put here some articles that we based our presentation on, and also, if you're interested in getting a little deeper into this subject. And ladies and gentlemen, the message I want to pass on to you today is that high magnification can improve your practice in a very cost-effective and ergonomic way, and also make dentistry a lot of fun. I thank you all so very much for staying here with me.
Thank you very much, Dr. Moura, and for all of our presenters this afternoon. We have a 30-minute break now, so we'll see everybody back in here at 3:30. Thank you.
Get him undone, and then you guys can have it.
Yeah. And there will be questions and answers after a while at the end of the presentation.
Good.
Yeah. Can I meet you after that?
Yeah. I think it was after the break. Just a couple more speakers.
Yeah, no.
Go to the panel.
Yeah, no.
Okay, good. Thank you very much.
Max, olha pra lá.
This is a Brazilian one.
This is Brazilian soul,
This is his girlfriend from...
It's not the same thing. Just I know. Take a look at it. Take a look.